So welcome, it's 5:30, we might as well start at the appointed hour and I'm sure we have you home not too late. So my name is Patrick Mcneil, I'm the Executive Dean of the Faculty of Medicine and Health Sciences here at Macquarie University. Really want to welcome everybody to this public forum. Thank you all for attending MQ Health's contribution to World Lymphoedema Day. So MQ Health is Macquarie University's Health Sciences Centre. It's a fairly unique entity that really brings together the things that universities are good at doing with the things that healthcare providers are doing, and ultimately to benefit patients with a range of conditions, including many of you here today. Before I start, I'd like to acknowledge the traditional custodians of this land that we share, where we gathered, and pay my respects to elders past and present. And I'd like to extend that respect and welcome to any Aboriginal or Torres Strait Islander peoples here today. We're very proud of the Alert program which has been created here at MQ Health. It's a very unique program, and I'll talk a little bit about why it is a unique program and why it's a flagship of what we're trying to do here at MQ Health. It cares for patients, people with primary or secondary lymphedema, as well as lymphedema. And at MQ Health, we have a purpose that's defined in 3 words: heal, learn and discover. And that summarises all the things we try to do in our clinical care. We bring our learning, we bring our research to the care of the patients that we look after. So Alert's a unique and differentiating program of MQ Health. It addresses a complex medical problem that I think it's true to say that often traditional medicine doesn't always tackle in a holistic fashion, such as is done in this program here. And all the work is underpinned by research, the discovery part of our mission. All the work is evidence-based, and through the research we do from external funding and publishing our results in high-impact journals. In terms of learning, Alert provides training excellence through the delivery of accredited courses in therapy, and as well as all the sciences that underline the therapy that is taught. And recently provided online education materials from the Macquarie Foundation Breast Care Nurses, which is really exciting. And our approach in everything we do, but particularly exemplified in Alert, is a patient-centred approach to care, where patients are at the centre of the multidisciplinary team that we bring to help. So thank you for attending this free public forum. I hope you find it stimulating and interesting. It gives me great pleasure now to hand over to Professor John Boyages, who's our Professor of Breast Oncology at Macquarie University and Director and Creator really of the Alert program, who will be facilitating the proceedings today. Thank you, John.
Thank you very much, Patrick. And I know you have to leave early today, and some of our other clinicians have to leave a little bit early. But thank you, all of you, for coming. And we were oversubscribed very quickly when we advertised this, but I'm really just a conductor of a very good band of people that I work with, and this is not all of us because we keep growing, but without these stars who are totally committed to patient care, research and education, the Alert program would not happen. Just a couple of housekeeping things. If you don't mind just checking your mobile phones and checking they're off, because we are videotaping this today, the presentation, so you can go back later and look at them on our website. The toilets are located behind the lifts, and we will have a 5-minute break between the presentations and the question and answer session to stretch your legs. In your information pack today, there are some bits and pieces. There's a media consent form. Now, we do have one of our staff taking some snaps. If you see them snapping you and you don't want to be snapped, please just say so. We won't get offended at all. But we'll be taking some from the back of the room of the speakers, if that's okay. In the top of your pack, there's an ask the question session. There will be mics later, but I know from previous experience that some people don't really like to get the microphone. If you want to ask a question and pass it down the corridor later, we will collect them and answer as many questions as we can. So please feel free to do that, and we'll collect them just in that 5-minute break. At the end, there will be an evaluation, and if you don't mind helping us to improve sessions for later next year's forum, for example, or if you want topics to be included in next year's forum, please list them down. And certainly our funding comes from the university, it comes from patient fees, it comes from donations, and if you've got any friends or family or anybody who wants to donate to our program, there's a donation slip there, and all donations over $2 are obviously tax deductible, because without support from the community we can't get this work done. And certainly, as we'll talk about later, funding public patients to have their surgery here is one of our ambitions, so that at the moment there are access issues for public patients. I won't go into all of this, but this is just a framework of our program: education, research, treatment. We do lots of workshops. We connect with therapists right across the country who see us as a sentinel site. And we get a lot of emails every week, Dr. Mackie and Louise and others asking our advice, and we try and provide that advice across the country. Research into surgery, into early detection, into home monitoring, psychological impacts, imaging is the sort of stuff we're doing, and we're connecting with partners right across the world, including a randomised trial with Vanderbilt University and also Stanford University. And treatment, you'll hear from Professor Swami later at some of our innovations in imaging patients for lymphedema, which I think will be practice changing in the way that we'll be doing our manual lymphatic drainage in the future. There'll be always more information on our website, which is in your information pack. That's our clinic number. And very quickly, I've got about 7 or 8 slides on a study we did with the Faculty of Business 2 or 3 years ago, just to show you the impact of lymphedema has on people's lives. You know this because you're living with this every day, and I hear your stories. But and we'll hear from our patient Jasmine in a moment. But when we did this survey across the country, we found that 51% of patients had mild lymphedema, 36% had moderate, and 4% had severe, and about 10% had lymphedema detected through bioimpedance. 60% of patients were from New South Wales, 20% from Victoria, and this was the time that they were diagnosed with lymphedema. From the 1 to 2 years after treatment was about 30%, 2 to 5 years, 36%, 5 to 10 years, 24%, and 10 or more years. And I was just talking to someone in the audience there who got lymphedema very late, and it's something that people are at risk for probably for the rest of their lives. When we look at where these patients are having their treatment, about 58%, 60% were having it in the public sector. Having worked at Westmead Hospital with Louise for 25 or 30 years, we know the demands on the public sector, the difficulty getting into clinics, the waiting times, and it's very poorly resourced. And you can see the rest of it is in private clinics. Interestingly, 53% of patients had the more expensive custom-made garments, where 47% had off the shelf. And you can see there that most patients, in fact, had sleeve and separate glove or hand pieces there, gauntlets, and or combined pieces. This is sort of this is a breast cancer study, of course. I know a lot of you here have got lower limb lymphedema, which we didn't survey. This is a type of treatments that people are trying: lymphatic drainage, massage, exercise, and we'll hear about exercise later, skin care, bandaging, laser therapy, and so on. When we looked at the impact of breast cancer or the impact of lymphedema on people's lives, and this is just a summary, high-level look at the data, you can see that the impact of lymphedema on work was breast cancer was 50%, but if you had lymphedema, 63%, family life, 59.74. Whenever somebody had lymphedema, over and above the stress of going through breast cancer, it just added another dimension to the psychological stress and trauma. And as I know Louise always says, you can hide your mastectomy, but you can't hide the fact that the compression sleeve in an arm and the people coming up to you all the time and saying what's going on. We also found that, and irrespective if it was work, family, social life, and so on, that as the lymphedema got more advanced, the more impact this had on all those dimensions. So that were the averages, but for patients with moderate or severe lymphedema, it certainly has a huge impact. And just to set the scene for our session on finances later, this is what the survey showed, that as you look here, going from detection via bioimpedance, mild, moderate or severe, you can see that the number of visits to a therapist increases from 2 a year to 8 a year for moderate, but you can see it then goes down for severe, because at that stage a lot of fatty deposition occurs and the garments and the compression and so on stops working, and that's where we'll probably talk a little bit about liposuction later in our forum. The cost of each visit to the therapist, how many garments do you have every year? And I know some of these garments can cost up to $500 or $600. And you can see the costs there going from up to $1,000 a year for the people with more severe lymphedema. And you can see that the cost of lymphedema, this is out-of-pocket expense for a lot of patients, we know is significant, climbing up to $1,000 for more severe lymphedema. And we know this is poorly funded in the community, and Dr. Mackie later will talk about advocacy and lymphedema. And finally, out of interest, we know that wearing compression garments is challenging. We know that. We, in fact, a couple of weeks ago met with a professor of garment design, trying to work on different ways we can make these garments friendlier, smarter. And we know that although a doctor or a therapist can say you've got to wear this 24 hours a day, of the 21 patients who were told that half of them are doing it 24 hours a day. We know that's a challenge, and many patients wear it at night. So that just sets the scene, and as I say, feel free to write your questions down, and there'll be lots of time for questions in a moment. The other day, I was up in the clinic, and as I do, and say hello to people, and I bumped into Jasmine, and I was impressed by her story to the point where I said, Jasmine, we've got this public forum coming up in 2 or 3 weeks, would you mind? And Jasmine, to her credit, stepped up and decided to come and talk to us today about her story. Please make Jasmine welcome.